Today is a great day. Why is that? It's because you've made a decision to learn more and get more information about a procedure that has the potential to change your life. It can change the way you eat. It can change the way you look. It can change the way you feel. It can give you your life back. And that's what Dr. Yaste, Dr. Chrsitian Yaste, the owner and head dentist at Ballantyne Center for Dentistry in Charlotte, he has dedicated the majority of his dental practice to smile transformations and smile makeovers. So if something in an email that you received or a text that you received sparked a desire in you to join this webinar, then I want to tell you that you're in the right place. You're going to hear from patients. You're going to hear from Dr. Yaste. It's the procedure is more than just getting an implant. It's more than this. It's a connection that you have with the practice. It's how you feel about the doctor that's performing the surgery. It's how they help make it affordable for you. They talk to you about what you want. They customize your experience. That's what this is about. I look forward to just interacting and engaging. I look forward to hearing some of your questions. I really look forward to you hearing some of these amazing testimonials because everybody comes from a different experience and a different background. I want you to think, what lens are you viewing this through? What position are you in right now? Are you ready to take that step to book your consultation, to show up for your consultation? If you're ready to do that, then by all means, I want you to watch this webinar. And I want you to take action. I'm going to put the link in the chat because you can book your phone discussion immediately with one of our dental implant experts, with somebody on Dr. Yaste's team. But I'm just excited, and this is going to be the time for you. So we're going to get our first testimonial on up here so you can hear directly from one of Dr. Yaste's smile transformation patients. Here we go. Do you guys see in front of me the beautiful Regina Fleener? I hope I didn't pronounce it incorrectly.
You're great.
Oh, good. With this radiant smile. You look wonderful. It's great to have you here, Miss Regina.
Thank you. It's great to be here.
So tell us what motivated you to get dental implants with Dr. Yaste?
The majority of my life, I've had very bad teeth, soft, break off. And as a child, I had horrible experiences at the dentist, starting at a very young age. So by the time I was a teenager, I had a great fear of dentists. Then at the point that I went to college, I just stopped going to a dentist and went many, many, many years without any dental work, to the point that I quit smiling and, really couldn't eat chewy things like carrots or apples or nuts. It just became kind of a lifestyle for me because of my fear of the pain at a dentist, which was crazy. But because my life as a child was such fear from a dentist, I just thought, well, I can live. And then finally, I thought, I really need to do something about this. So I did a lot of research, and narrowed it down to this center, to Dr. Yaste. It was the best decision I've ever made. It was
What
great.
made it the best decision? Like, what was it about Dr. Yaste's practice, his team, that since you had done so much research and kind of shopping around, how did you land on Dr. Yaste?
Yeah, and I didn't go to anybody else. I had called another dentistry, and they never did call me back. But I looked at his background, his education, his story online about his concern about patients and their pain and their lack of dental work and why, and that nobody here would make fun of you or laugh at you or say things behind your back.
Right.
So when I came, I came for a consult and immediately fell in love with everybody that greeted me, and Dr. Yaste was just outstanding. And it was that very day that I said, I'm going to pull the trigger. Yes.
So you were able to conquer your fears in the consult, like where everything was resolved and you felt really good about it?
Yeah, I did. And I was ready. My significant other was not happy with my dentition and had said some things to me that were not exactly nice, but were the it was the truth.
A hard thing to
A
hear.
hard thing to hear.
Mhm.
I'd heard it before, but it meant more coming from Mark. And so when can we do it? Tomorrow?
Right.
Once I make up my mind is made up. And
So tell us about, I guess, your experience going into surgery. And I know sometimes folks have said, outside of the investment, because obviously we know dental implants are an investment.
it's expensive. Yes.
Yes, it is investment. Definitely you want to make it with the right person and with the right people because it is a large investment. How did you feel going in like surgery day? Like how was that day?
I felt confident, nervous,
Mm-hmm.
and knew that I would have pain coming out, but I manage pain quite well. I don't respond as significantly to pain as many people do.
Mm-hmm. Mm-hmm.
So I was anxious, nervous when I saw all the things in front of me.
The tray of instruments.
All the trays. And actually, Mark came in with me and he about dropped over. He was like, "You really sure you want to do this?" And I'm like, "Oh, yeah, I am very sure." So he was more nervous than I was. So, I talked to the anesthesiologist and we
Went to work.
it worked.
Yep.
Everybody was great. And when I woke up, everybody was there. And
You had that new smile. Like, what was your first thought when you saw that new smile after some of the swelling had gone down? You could really get a clear picture of it. How'd you feel?
I don't want to give everybody the wrong impression. I didn't have a lot of swelling.
Mm-hmm.
I had almost no bruising, a little spot here,
Mm-hmm.
just a little here.
Mm-hmm.
And I had such minimal pain. It was unbelievable because I felt like I would have a lot of pain.
Yeah, you had set yourself,
How
prepared
did I
yourself
feel
for
when
it.
I first saw it? I'm like, oh my God, I should have done this so many years ago. Yeah.
You
it
look
was,
so good. Like, what's been different in your life now that you have this new look and this new smile? Like, what's different now?
I laugh a lot and I smile a lot. I eat carrots now and peanuts and almonds and
Mm-hmm.
crunchy stuff that I
Mhm.
just couldn't eat before. I guess I've been confident the majority of my life, but I feel much more confident.
Yeah.
And a lot of people have said, "What did you do to yourself?" Along with it, I lost a lot of weight, not because of the dental work,
Right.
but, although you will lose some weight because you can't eat a lot of
Yeah,
foods
in the
other
beginning.
than soft foods or liquids in the beginning. But
Mhm.
it's just changed me.
Mhm.
I just smile all the time, and
Yeah.
it's nice to be able to do that and not hide your mouth.
Some people have even said it gave them their life back, like where they just felt normal and felt whole again. So,
Yeah, I think that's a good way to put it. You just feel normal. You
Yeah.
feel like you can interact with people more appropriately, and that they're not going to stare at your bad dental hygiene.
anybody that's out there watching this and they're on the fence or they're concerned about the financials or their fears or whatever their block is, what advice would you give to those people so they can go and get their life back and have their transformation?
There are ways financially you can do it. I think you all will help them do it, find a way.
Oh yeah, Dr. Yaste, the team, they've got ways, like millions of ways to help get it done.
And if you're afraid of the pain, don't be. I mean, I just had very little pain. I was shocked. My significant other's brother just had some work done down in Florida, and he's had a tremendous amount of pain with his implants. So I think it's individual. However, the medication is there for the pain. You put ice to decrease the swelling and the pain. As long as you follow what you're supposed to follow, that can be dealt with. And it's a short amount of time compared to however long you've had really bad dental hygiene. So you just really need to take that step. You'll regret for the rest of your life if you don't. And when you do, you're going to come out and say, why did I not do that?
Why did I do it?
A long time ago.
Right.
Why was I so afraid?
Well, you look great. Keep smiling and showing that beautiful grin. I'm just mesmerized. You look so good.
I feel good. It was just a really smooth process. Everybody here is just great.
Well, it's a team approach over there.
Gosh. And yeah. And every time I come in, it seems like, oh, I haven't met you. Some of the girls would come in and say, oh, I remember your surgery. I came in because mine was very extensive. I had all upper and lower.
A full mouth. Okay.
Full mouth. And it was very extensive. And the other thing is I healed significantly quickly.
Nice.
So I was six weeks ahead. So I got my permanent implants
sooner than most.
6 weeks earlier. Almost 6 months earlier. Yeah.
This has been great. Miss Regina, I appreciate you so much for being so giving of your energy and telling us your story. I know that you're putting a lot of folks' fears at ease out here.
Okay.
Just being able to talk about it, because I do understand that it can be a sensitive topic for a lot of people, but everybody's going through their own transformation, their own story. You look great. Thank you again for your time, and we will see you soon, Miss Regina.
Thank you.
Oh, wow. So we've got the beautiful Miss Lauren Jones here, one of Dr. Yaste's patients. She's going to share her story with us about her own dental transformation. Hello, Miss Lauren.
Hi, how are you?
I am doing great. You have an amazing smile. Lauren, tell us about your experience at Ballantyne Center for Dentistry.
Yeah, so this is actually a gift that I have gotten from Dr. Yaste and Dr. Joe, and who used to be a dentist here, which bless him, we miss him. I was reached out to because I was on a journey of eating disorder recovery, I had an eating disorder. And I battled that for 16 plus years. And I was connected, thankfully, to Dr. Joe and Dr. Yaste and Ballantyne Center, and was given the opportunity to have this transformation and change my whole life and give me that new meaning that I've worked so hard for in my recovery, and be able to be comfortable in my skin that I'm in as I've been able to go along on my journey. And that's kind of how I've ended up here. They've reached out to me and have given me this blessing that I probably have never been able to achieve by myself. And they've been able to partner with me and really give my life back to me through, my smile. And, that confidence and, the ability to give back as well, coming here and talking to you and letting you know my journey and through a recovery standpoint, having this procedure done is huge on someone's life and how it can, transform them into who they should be today. And that's how I feel. I go out in the world and I smile every time that I can, and also to share my story when I can. It may not be to the extent of giving everybody my journey, because that's not everybody's, path, but where I can say hey, having this kind of procedure done and, getting that, chance to get that smile that you've always wanted and be able to have that partnership and that relationship, that's huge. And I'm so thankful for everything that has come about on my journey and the relationships that I've built here at Ballantyne. They're like family to me. Literally, I maybe can't give them a hug right now, but I hug them in ways that I can and give back as I can, because they've given back my life.
So when you say getting your life back, because a lot of patients do say things like that, these dental implants have changed me. What specifically do you mean by getting your life back? Was it eating better? Was it just being able to smile? Talk to us about that.
My teeth that I had before, they were decayed, missing, broken. It was very hard for me to eat. So on my recovery journey, trying to be healthy, it wasn't always a thing that I could do because I didn't have the correct foundation in my teeth. I would eat and they would break. They would be painful. Like I said, my front teeth were gone pretty much from just my eating disorder. And so, I was doing the work and what I needed to do, and then my teeth were holding me back. So, by me, getting this procedure done and, being able to have now strong teeth that I'm happy to smile with and show, but they're functionally there for me so that I can live a healthy life and, be able to enjoy good food too, so not just a beauty thing, it's also a function thing that I've been able to gain back.
So after you had your procedure and your surgery and you saw your new smile, how did you feel? What were your first thoughts? What went through your mind?
Overwhelming. I cried, like ugly girl cried. I was extremely overwhelmed and thankful. And I can never express how blessed I am to have this done. And, like I said, I smile constantly and I wear red lipstick and I'm proud, Yeah. So it was a great feeling. And still every day when I wake up and I look in the mirror and I smile, I am so happy with the decision that I've made to have this done and feel confident.
The last question I want to ask Ms. Lauren, if there's somebody that's on the fence, for folks that maybe haven't been to the dentist in a long time, or they do have other issues that have led to tooth decay, it's a hard first step to make to go back to the dentist if you haven't been in 10 years, or to pay for a procedure or anything. What advice do you have if somebody's been shopping around for years and hasn't really taken the plunge to go get a consultation and to get their transformation? What would you say?
Yeah. So obviously it's a huge procedure, and it can be scary. Like one change is scary in itself, but if you don't take that chance and even just start that conversation, you'll never know what you could have and how it could change your life. So it's okay to be scared. I was scared myself. Oh my God, even the teeth that I did have, I wouldn't have them anymore. What? I'm going to have nothing? Wait, but I'm going to have these? And I can design them? Okay, wait, let me wrap my head around it. So it's okay to be, on the fence. It's okay to be scared, but start that conversation because it can change your life in ways that you don't even know until you have that conversation.
Lauren, you're beautiful. Thank you so much for your time today. I know that your story is going to resonate with a lot of people, and thank you for being so sharing and giving of yourself. We really appreciate your time today, Miss Lauren.
Yeah, and Lauren, it was so nice to meet you. And you have a beautiful smile as well.
Thank you. Thank you.
You light up the room.
Oh, you're sweet. Thanks again, Lauren. We appreciate you. Well, it is my pleasure to introduce Dr. Chrsitian Yaste of Valentine Center for Dentistry. Dr. Yaste, I believe you've been the top dentist in Charlotte, one of the top dentists in Charlotte for 3, 4, 5 years running now. You have just been killing it out here. Everybody just loves you. And I know why. It's because of all of the smile transformations and how much you just care so much about your patients. How are you today, Dr. Yaste?
I'm very well. Thank you, Lauren. It's great to see you.
Good to see you as always. And I know very well that you are very well known in Charlotte because of your full mouth reconstructions, your dental implant procedures, upper arches, lower arches. What is your favorite implant procedure?
By far, my favorite implant procedure is when we restore someone's entire smile. So we place the implants. Usually we have to take some teeth out if there's bad teeth or if somebody doesn't have teeth, put the implants in and then build that whole new smile. And I think I like it so much because I've always enjoyed the creative side of dentistry, and it really allows me to build things. So, and I get to engineer the process. If I wasn't a dentist, I probably would have been an architect or an engineer or something or in construction, because I love to build things.
Right.
And so I get to build someone's new smile, and then we get to see how they transform from the smile that they didn't have any confidence with or they couldn't chew with to this new smile. And I love watching the smile transformations. It's my favorite thing by far.
I was just going to ask you, what's your favorite part? But obviously going through this process with each patient, I know you get that connection with it. Actually, your whole office probably gets connected to each of these patients. We met several of them, and they have beautiful and amazing stories and smiles. And you've been doing implants, gosh, for so long. I mean, how long have you been?
20 years.
Yeah, 20 years.
I did my first implant when I was in residency at the local hospital here in Carolina. It used to be Carolina's Medical Center. Now it's Atrium. But I did a oral medicine fellowship there. And that's when I placed my first implant, and that was 1996. So we've been on and off placing the implants, but really the most of the implants I've placed have been in the last 5 years. That's when my late partner and I decided we really wanted to help people transforming their smile and doing all the surgery and everything in our office all under one roof, so that they didn't have to go to multiple people, to have multiple doctors, and that we could control the experience that they were having, and we didn't have to worry about, an issue at a surgeon's office or somewhere else. And it's just nice to be able to control that experience, because we know we can do a really good job at it and make people feel comfortable. So that's been really rewarding.
And also too, for your office, the process to get in with you or to, actually even get on schedule for surgery, it all starts with a consultation, right?
Yes, we usually encourage people to come in. They've been told maybe that they don't have enough bone for implants, or their teeth, or they're going to have to wear dentures, or they're going to lose all their teeth. And it's just easier to get to know people and start building that relationship just by having them come in and sit down with us for 20 minutes. And we offer a CBCT scan. It's basically a 3D scan at no charge. That way, again, they get to know whether they're a candidate for what types of procedures, and they don't have to really make a whole lot of commitment before coming in, and then they know. I mean, we're here to help people first and foremost. And if it's something that they are interested in or they want to move forward, then by all means, we have them come back and then the process begins. But yeah, that first visit is usually just to meet my team, meet the doctors. Myself and Dr. Binns do most of the implant surgeries in the practice. It's also kind of fun for us too, because it's always nice to meet people that we think we can help and tell them that there's hope. They don't have to live like that any longer.
Oh gosh, yeah. So there's some questions that are starting to pop up. So didn't know if it was okay just to ask a few questions. I know we don't have a lot of time, but someone asked, do you customize just the smiles differently for every single patient, or do you only have just one or two options to pick from?
No, every single smile is customized. So we base it on a lot of different things. Sometimes people come in and they say, this is a picture of when I was 25 years old. I loved my smile. Can I have that back? And the answer is usually yes. Or they'll bring in pictures from magazines, or they'll say, we had a patient that literally told my late partner, I want your smile. I want your teeth. And we were able to digitally copy Dr. Joe's teeth and give them to this gentleman. It was insane. It was really crazy what technology can do. But yes, everything is customized. We do a smile preview on people so they can kind of see what their new teeth might look like. Then there's the process of going through sometimes people are gonna have a temporary set of teeth, and then they're gonna move on to a final customized set. And every step of the way, we give people options on giving their input. And sometimes they'll say, well, you're the expert, but we may be the experts, but there's definitely people have different tastes in what they want and how they want their teeth to look, and we're here to help them with that. We use a phenomenal laboratory. You literally cannot tell on a lot of people that their smile isn't a totally natural smile, that it was fabricated out of zirconia or some of the other exotic materials on the market. But just amazing results we're able to get with technology now.
I love that. I got another question. Someone has asked, I am really, really scared of surgery. So do you keep people awake, or do you allow them to be sedated?
That is one of the biggest differentiators in our practice. Is I myself am not a fan of going to the dentist. So I can't even imagine having like a big surgical sort of treatment done while I was awake. Yeah. So 99 times out of 100, we have an anesthesiologist that comes into our practice and we put them to sleep. The anesthesiologist has a giant general anesthesia machine, and that's part of our surgical suite. And that way patients don't have to worry about waking up or feeling anything uncomfortable. And it's a very quick procedure, because as soon as they go to sleep, they wake up and they don't remember anything, and they wouldn't have anyway because they haven't been awake. But that's something that we offer as basically a part of our services that unfortunately not all doctors do. And then people can have negative experiences and very uncomfortable experiences with the surgery, because it's a major surgery. This is a procedure that, for all intents and purposes, 20 years ago would have been done in a hospital setting. But because we do it, with a guided digital solution, we're able to do it faster. It usually takes us between 4 to 6 hours to do this procedure, and nobody wants to sit still for 4 to 6 hours.
Right. Now this is a good one. I think we have time for this last one. People obviously want to talk about the investment. And I personally know your amazing team, and they have lots of different ways to make things work. How can you address, the expense of dental implants?
You know what? I wish they were less expensive. One of the things that I've focused on in the last few years is just trying to make things affordable for people. Mm-hmm. So whether something's expensive or not is less a concern for me. And I think really most patients and consumers, they want quality. They want the best that they can get. It's just a matter of, can they afford it? And, having something that's expensive, as long as it's affordable and can fit into your budget, then it's fine. It ceases to be really expensive if it's affordable. And so that's really what we focus on, is how can we help our patients fit this into their schedule, fit this into their time, fit this into their budget and their lifestyle. And once we've done that, it's just a matter of moving forward. So that's the biggest challenge, though, for most patients, is the cost can be daunting, can be a little overwhelming. And we're in the business of trying to offer options for different costs and allowing people to get in varying levels. So yeah, it's a big thing, and we need to talk about it. And we're not afraid to talk about that. We love to have conversations with people about how we can fit it into their budget.
I love that you said that, because that's a lot of times can sometimes be the only thing that keeps people from moving forward. But I know very well that your team really, really does work with each individual patient in whatever financial position they're in, to make it affordable and make this part of their normal budget. So I think that this is a perfect time to let everybody out there know that right now, if you want to take action and move forward and book a consultation or speak with someone on Dr. Yaste's team, this is the time to do it. I'm going to put the link right here in the chat. Go ahead and set it up. All you have to do is click and book an appointment. It's just a phone call. It's just a discussion. But this is the team that you want to work with when you are moving forward into a transformation. I know this team very well, and they are ready and excited to just answer your questions and see if they can make this work for you. Dr. Yaste, thank you so much for stepping out of the exam room to chat with us today. I'm gonna let you get back to your day. Like I said, everybody out there, now is the time. Go ahead and take action. Valentine Center for Dentistry is excited to work with you.
Thank you,
everybody.
Lauren. All right.
Bye.